Good evening. Welcome to our presentation tonight. We're going to be talking not only about vitamins and heart health or proper medical supplements and heart health, but we're also going to be talking about what medications that are used every day can do to your heart health in not such a good way. So of course, we definitely need medications to keep ourselves healthy. But did you know that some of the medications that we take can actually decrease needed micronutrients in the body and therefore improve your health? So we need to supplement those. Well, for those of you who don't know me, I'm Dr. Birkenstock of Skin Body Health. We have offices in Mandeville, Louisiana and New Orleans, Louisiana. We're also licensed in Alabama and Florida. We come on every week to let you know the latest and greatest anti-aging topics and secrets and what's new going on so that you can live a life of vitality and longevity. We've been talking a lot about the new cancer research, and last week we filmed in Honduras. We'll be talking more about that because there are actually more breakthroughs with one of my colleagues over at the Mayo Clinic, and that'll be another topic that'll come in a few weeks. But for now and for tonight, we want to talk about what medications that you take that could be harming your micronutrients, otherwise known as vitamins and minerals, and what you can do about it. So for those of you who aren't as familiar with us, don't forget that we have a YouTube channel. We've been on for years, and if you want to go back and look at any of our research or webinar talks about vitamins, minerals, erectile dysfunction, ladies' menopause health, hair restoration, Botox fillers, and the like, we're there on our YouTube channel, Dr. Birkenstock Skin Body Health. That's Dr. Birkenstock Skin Body Health. Please like and share, because there may be someone you know, a friend or a family member, that could benefit from our information. So tonight we're going to be talking about our Heart Healthy Bundle, and always remember to look for the GMP seal of approval when you're buying vitamins, because that way you know they're produced in an FDA approved facility and they're going to actually have the potency that they promise on the label. Okay, so without further ado, let's talk about what's important supplement-wise for heart health and what some of the medications we may be taking might be doing to fight against that. So what we know, proven, now there's a lot of myths out there about vitamins. There are a lot of my colleagues that don't believe in vitamins, but they're becoming more and more accepted to the general internal medicine and medical health. When something makes it to a peer-reviewed journal, that means something like JAMA or Circulation or Diabetes or Endocrinology, when you're making it into those medical periodicals, those have been peer-reviewed studies, and that's not just someone's opinion or hoopla or marketing. It's actual scientific evidence. So in the Circulation journal, which is a cardiovascular journal, the word circulation, we have shown in that article that you can reduce the risk of death from all causes of death, not just heart health, but by a relative risk of 0.68, and that's a statistical term that tells you about the validity and the strength of a study. And what they showed is that the coenzyme Q10 ubiquinol is the active ingredient in CoQ10 that makes it work. So if you just picked up a CoQ10, that did not have ubiquinol, and there's other words inside some of the fakes, right? But ubiquinol inside of it, then you're not decreasing your risk of all-cause mortality, or meaning all-cause death. So the recent study published in Circulation found that coenzyme Q10, ubiquinol, was found to be one of the most effective dietary supplements in decreasing congestive heart failure. So many of us have relatives, friends or family members that have been affected by congestive heart failure, and it's a horrible thing to live with. You have to watch your salt, your diet, you have to take your medicines exactly on schedule, or you run the risk of getting into congestive heart failure where really your heart's drowning and you can't even breathe. So coenzyme Q10, ubiquinol, is a very, very important supplement for heart health, and I wholeheartedly support it. What also we can talk about when we're talking about heart disease prevention, there are several micronutrients that absolutely have been proven to prevent heart disease. Well, what are they? CoQ10, ubiquinol, as we just discussed. Second, omega pure fatty acids, okay? So fish oil. Well, what makes one fish oil different from another? It's the EPA that is inside of it. If it's got a strong or high grade, medical grade EPA, that's what makes the fish oil work. Otherwise, you're just swallowing motor oil. So make sure the supplement that you get has a very strong EPA, 800 milligrams or more, and also has the GMP seal of approval. Because if you don't have the GMP seal of approval, they could say 800, 1,000, they could say anything on the label and not have that within your vitamin. So omega pure. So number 1, CoQ ubiquinol. Number 2, omega-3 fatty acids. Number 3, B9. So L-methylated folate B9 is the form of vitamin B, boy, number 9, B9, that makes it very highly absorbable and usable in the body. There are many people that have the MTHFR mutation. You may or may not have heard about this. It's kind of been in the literature now and online a lot, so people are reading about it. And L-methylfolate B9 is the absorbable form. So if you have the MTHFR mutation, you could still get your absorption from this product. If you've got the MTHFR mutation, which about 50% of the population does, if you just took folic acid, it just goes right through you. And it's making your appliances very healthy, like the toilet, but it's not doing anything for you. So the third one, L-methylated B9. And then as we go on, the two that really decrease the risk of cardiovascular disease are magnesium and zinc. So magnesium, I love this product, Magnesium 3-Night. It's got 3 different types of elemental molecular magnesium, and not mag oxide. That's what you find in the drugstore, and that's not what we're talking about here, and that's not really helpful. But magnesium, glycinate, glaucopyrophosphate, etc. is in this product, helps you sleep, keeps your bowels moving, decreases your blood pressure in a very natural form through nitric oxide, and it's just very good all the way around. So I highly recommend this product. You take it at night. It helps you sleep beautifully, and exactly, and keeps the bowels moving well. And last but not least, zinc. Zinc is so great for hair growth and heart health. It's just a win-win all over the place. And for gentlemen, it's very, very good for prostate health as well. So my top 5 in the heart health bundle, and yes, we're having a sale, are zinc, CoQ ubiquinol, omega pure fish oil, magnesium, our Magnesium 3-Night product, as well as the L-methylated B9. So this 5 bundle, which is great for heart health, hair growth, we could go on and on, memory, sleep, constipation, and bowel disorders. It's usually retails for $280, and it'll be on sale for $224 until March 1st. That's $224, the Heart Healthy Bundle. But let's talk a little bit more, because I kind of teased you in the beginning and told you that we have to have medicines, but they might be decreasing our micronutrients and vitamins and minerals. So which ones do this? Well, when you get blood pressure, one of the first things you put on, and it's a great product, there's many different names, but it's very gentle giant, and it's called ACE inhibitors. So ACE inhibitors are things like Lotensin, lisinopril, And there are many, many other ACE inhibitors. And while they're absolutely great at decreasing blood pressure, which is the silent killer, they also decrease zinc. They also can lead to hair loss. So Zestril, lisinopril, Lotensin, and there are many others. You can ask your doctor or pharmacist and they'll let you know if you're on an ACE inhibitor. We do not suggest, please don't get off of any of your medications, but by all means, how easy is it to supplement with zinc to prevent hair loss and to prevent any heart health issues? We want to increase our zinc, not decrease it, to improve the risk of cardiovascular or heart health problems in the future. Another very, very common diabetes product, and it's an excellent medication, and we're not saying it's not, but we do need to know something about the side effects and what we can do to block the side effect that we don't want and improve our health, and that would be metformin. So metformin is an old great standby. It's used for PCOS, it's used for diabetes, it's used for a lot of things. And while it has a lot of great benefits, including bringing blood sugar down, it also brings vitamin B12 down, and we think other B vitamins as well. So if you're on metformin, please don't stop it. Don't ever change your medications without consulting your personal physician. Metformin is a great medication, but you must supplement your B12. B12 is best gotten in the form of an injection in the hip. It's not very easily absorbable through the gut, but very easy to do. There are some medical forms of B12 that are a little bit more absorbable, but by and large, the B12 you pick up off the shelf at the vitamin shop, GNC or Walgreens really aren't going to lift your vitamin B12 levels up to a significant level. Statins. Statins are used for high cholesterol. High cholesterol will put a buildup in our coronary arteries, our penile arteries for male health, our cerebral arteries, which can lead to stroke. So, whether it's erectile dysfunction or heart attack or stroke, none of these things are welcome warriors. But we do have to take a statin to decrease the cholesterol. So what also happens? When you decrease your cholesterol with a statin, you're decreasing your coenzyme Q10 ubiquinol. So your CoQ10 inhibits an enzyme, a very important enzyme in the body, and coenzyme reductase, and that brings down the CoQ10 levels, which makes ATP in the muscles, and so it's a big consequent set of events. So if you've ever taken a statin or someone you know and they say, "Oh, I have muscle or joint pain," it's because of the decrease in ATP from the decrease in CoQ ubiquinol. So a very easy solution is when you swallow your statin at night. And yes, anything for cholesterol medications should be taken at night, because the liver makes cholesterol when you sleep, so that's the best time to take it. When you take your statin, swallow a CoQ ubiquinol with it, and voila, muscle aches and pains go away, you continue to make your ATP, the body continues to do well, and so we can take our medication needed for cholesterol without hurting or harming the human body. Next is Tylenol. So Tylenol is a product that a lot of us use for headaches or for fever, joint pains, backaches, whatever. It's a fine product, but what we must know about Tylenol is it decreases glutathione. Glutathione is a major antioxidant for liver health, and also glutathione supports growth hormone and increases in growth hormone, which increases longevity and vitality. So we have to be careful about the amount of Tylenol that we do ingest. You take it when needed, but if you can get away with using magnesium powder for a headache, or magnesium powder for a backache, or even an Epsom salt bath, which contains a lot of magnesium, try that first. Try that first before we grab for that Tylenol product. Last but not least, proton pump inhibitors. There are many brands. This one is Prilosec, not picking on that one. Same thing with Dexilant, same thing with Nexium, or any of the other proton pump inhibitors for reflux or GI or stomach pain. So many people are on them. And so many times than not, after a few weeks or even months, they could get off of the Prilosec or the Nexium or whatever, and everything would be just fine. But sometimes people are chronically on these medications, and then the body wreaks havoc. Because proton pump inhibitors for the stomach, for all the reflux medications, they decrease acid. Well, short term that might be a good thing if you're having an overproduction and you're having a lot of GI pain with red sauces or adult beverages, alcohol, whatever, that got you into that shape. Or even stress can make a lot of extra acidity in the gut. But what happens is you get a decrease in your absorption of important nutrients when these proton pump inhibitors, like your Nexiums, like your Protonics, Dexalons, etc., they block the absorption of iron, magnesium, B1356, B9, B12, calcium in the gut. So when you're not getting these important micronutrients absorbed, iron, magnesium, all of your Bs, calcium, what happens? Well, number one, you can get osteoporosis. Number two, you can get heart disease. Number three, the proton pump inhibitors, Nexium, Protonics, Prilosec, whatever, inhibits your absorption of nitrates and nitric oxide. So you're eating all these superfoods because you heard they were good for you, beets, onions, and almighty garlic, and they are great for you. But guess what? These medications inhibit the absorption of all the micronutrients from these superfoods. So they're blocking the good effects. You might as well not be eating them at all. So talk with your doctor about weaning or using less of these proton pump inhibitors after the initial ulcer or gastritis or whatever is going on is under control. Because there's no use of taking something indefinitely that's especially going to harm your health. That's the main message we wanted to talk about today, and we're so happy that you joined us. Don't forget to like and share. Each person that likes and share will be involved in the drawing for our Heart Health bundle. That drawing will be done on Friday, so please like and share is to be put in for the drawing for our Heart Health bundle. You can go to our store, skinbodyhealth.com, and know that the retail price is $280. The sale price on the Heart Healthy bundle is going to be $224 until March 1st. If you're watching us from TikTok or Instagram, like and share to be involved in our monthly drawing for free vitamin products. Once again, our YouTube channel, Dr. Birkenstock Skin Body Health. That's Birkenstock with a U. Dr. Birkenstock Skin Body Health. Thank you and good night.